this lesson, I'm going to explain how fetal circulation works in utero and how this is going to transition and how it will occur once the baby is born. So let's understand some of the big picture items before we break it down into more detail. The fetal circulation, it's a closed circulatory system. So what does this mean? It means that the maternal blood does not mix, okay? So there's no mixing of blood. No maternal or fetal blood mixture. So how does this happen? The nutrients from the maternal blood supply at the uterus is absorbed. So the blood supply, if we have our uterus, the blood supply coming in here, and we have a placenta, and that's going to help pull those nutrients. So no blood mixing occurs. The oxygen and the nutrients are now going to diffuse through the fetal circulation at the umbilical cord. So let's look at that. So our blood flow coming through the placenta. If you have your umbilical cord, it's going to look like this when you were to look at a cross section of it. So there are two arteries and one vein, and you can remember this by AVA, AVA, AVA. So our arteries are the small ones, and our vein is that big one. So with this, if you ask me, it seems a little bit backwards on their role. So let's talk about that. The two small arteries are going to take waste away, okay? So the arteries, they take waste away from the fetus and to the mom for secretion or from fetus. So I remember this. Besides the AVA, A and away. So we have A equals away. So it's moving away from the fetus and going to the mom, and the mom will secrete or excrete those wastes. All right, now we have the V. So this would obviously do the opposite. So that big vein is going to take oxygenated blood from the mom to the fetus. Oxygen-rich blood, nutrient-rich blood is going to go to the fetus by the vein. So arteries are taking waste, and the vein is taking the oxygenated, nutrient-rich blood to the fetus by the umbilical vein. So with fetal circulation, there are bypasses throughout because the fetus doesn't need blood to go places like the lungs or the liver. So these bypasses let the blood flow get around and get the oxygenated blood where it needs to go quickly. So the last big picture point is that gas exchange does not occur at the alveoli at the lungs. Like I said, the blood flow is not needed there because it's not doing gas exchange. The lungs are filled with fluid. So because of this, they don't need to breathe or exchange oxygen, and the fluid that is there creates a high pressure, therefore a high resistance. And that's just going to play a role in these bypasses and getting the blood where it needs to go. Okay, so now onto these bypasses that I mentioned. The first we're going to talk about is called the ductus arteriosus. So this one is going to connect the pulmonary artery and the aorta. So the pulmonary artery and the aorta, again with my first letter things, arteriosus is the artery and the aorta. And this is going to bypass the lungs. So if you look in this image, you can see that there is the ductus right here where it's circled, that ductus, and the blood is going to move from the pulmonary artery and go into the aorta, and that is going to bypass the lungs. The foramen ovale, this one is another bypass, and it is going to connect the left and the right atrium. So blood is going to be shunted from the right to the left through this, right to left. And that's going to bypass the lungs. So in this image on this side, in the fetal heart, because this is after the baby's born, so look at the fetal heart image. You can see the foramen ovale is here, this little mark right there. And that is going to shunt blood from the right atrium to the left, and that's going to bypass the pulmonary artery and therefore bypass the lungs. All right, our last little bypass to talk about is the ductus venosus. So here we are, RV. Ductus venosus is going to be umbilical vein taking the blood to the inferior vena cava, and that will bypass the liver. So here the blood is shunted from the umbilical vein up into the inferior vena cava. You can see it better in this image. So it comes through the umbilical vein, goes to the inferior vena cava, and bypasses the liver. So this is going to help get oxygenated blood to the heart quicker and to the brain, because we don't need to get the oxygenated blood to the liver at this point. Our therapeutic management and education. We are going to want to assess on ultrasound that proper circulation is occurring and that there is good blood flow through the umbilical vein. So this can be done. We're going to make sure that this is happening. So we're evaluating. This can be done on an ultrasound. They can look at the blood flow coming through the umbilical vein to make sure that good oxygenated rich blood is coming to that fetus. After birth, we want to ensure that all of these bypasses, they close, because now we have a newborn heart and we need it to function as a newborn and not as a fetus living in water. So it can take usually sometimes 24 hours for all of those ducts to close all the way. If they do not, then the newborn could have difficulties with perfusion and oxygen. Murmurs. So murmurs are going to be a normal finding on a newborn in the first 24 hours, because remember I said it could take 24 hours for those to close. So that's going to be like a loud whooshing noise you might hear would be the murmur as those ducts are closing. If the murmur lasts for more than 24 hours, then they might do further evaluation, like an echo to see what is happening. Now, for more information on these pathways and what happens if they don't close, you can revert to the congenital heart defect lesson. The murmurs will be really the only education piece to give to the families. And obviously we can explain what's happening, what we're looking for, but cardiac and fetal circulation can be very confusing to somebody that's non-medical, even for people that are medical. So really, if a murmur's heard, detected at birth, then just kind of letting them know that it's normal in the first 24 hours so that they're not worried will be our big education piece. Our nursing concepts are going to be reproduction, perfusion, because it's cardiac, and human development, because all of this is part of human development. Okay, so let's review. Don't know about you, but I think the heart is fascinating, but also confusing, especially fetal circulation. So let's review some of the details. We have AVA, which if you remember is standing for, we have 2 arteries and 1 vein, and this is talking about the umbilical cord. The arteries are going to carry the deoxygenated blood away, right? Our A and our A here. And then 1 vein, and that's going to carry our oxygenated rich blood to the fetus. We have a ductus arteriosus. This is going to move blood through the right ventricle to the pulmonary artery. Then it's going to go through that ductus arteriosus to the aorta, and this is going to bypass the lungs. The foramina valley, this is going to cause some blood shunting. It's going to shunt from the right to the left, and that's going to bypass the lungs. And then our ductus venosus. So this is the umbilical vein. Remember, is bringing that oxygenated blood in. It's going to go straight to the inferior vena cava and bypass the liver. And then our lungs. Just important to remind and remember that there's no gas exchange at all happening in the lungs. That is all happening in the placenta. Make sure you check out the resources attached to this lesson and review all these pathways. Sometimes drawing it out with arrows pointing to the direction of the blood flow can just help commit it to memory. There is also a great cheat sheet on fetal circulation that you can use for your review. Now go out and be your best selves today, and as always, happy nursing.